Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vic Sinise. We got a great episode for you today. Today, we're going to be talking about what is BPH. Stands for Benign Prostatic Hyperplasia or prostate enlargement. So first of all, what is the prostate gland? Well, we can see from this slide that a male has a prostate gland right below his bladder, and your urine travels right through that. Always look at this one here. We see a little bit better how that works. So the urine travels from the bladder through the prostate gland. So it actually makes up part of the urethra. Now, what happens as we age and the prostate enlarges, it can actually cause some blockage to occur of that area. And that's when you start getting all of those symptoms. What does a prostate do? Well, the prostate's the organ that produces the fluid that comes out when you ejaculate. So the testicles make sperm, but the fluid is actually produced by the prostate gland. Now, here's my representation using a balloon, a donut, and a sausage. But this is kind of what our urinary tract system looks like. And I think that it's a good representation. The balloon is at the bladder, and it squeezes urine out that travels through the hole in the donut, which is your prostate, down through the urethra. Now, I like the donut because it's a good way, I think, to visualize what a prostate's doing. So I showed you where it's at. It's right below. It's part of the urethra. It's right below the bladder. But what happens is the prostate can enlarge. And just like a larger donut, being bigger doesn't always mean it's a problem, because as long as you've got a nice big hole, what you urinate through the center of the donut, you got no problem. However, sometimes when you get enlargement, the enlargement not only occurs outwardly, but inwardly. And that starts to choke off that stream. And that's when you start getting the symptoms of BPH. I also think it's good to have ways to understand what does prostate enlargement look like. Well, most of the time when we're evaluating your prostate, we're talking about the outside size of it. A normal prostate is like this little chestnut over here, which is about 20 cc's in size. So a normal 20-year-old is probably going to have a prostate right around that size. Now, as it starts to enlarge, most of the stuff that we're treating is in this area here. That's the size of a golf ball, which is 40 cc's. So if your prostate's getting to be the size of a golf ball or bigger, you may be having some problems. Now, we see prostates getting as large as a baseball sometimes, and those can really cause a lot of problems. Those are the big 100 cc's plus. I've seen prostates that have been up to 300 cc's. Now, again, it doesn't always matter how big it gets. It's the main thing is whether it's starting to block off the flow of urine. Now, we know that it's something that's more commonly as we get older. So as a man ages, the risk of having issues with your prostate increases. We're not sure the exact cause of BPH, but we do know that the hormone testosterone is a big contributor to that. And actually, it's not the high testosterone so much, but something called dihydrotestosterone, or DHT, we think plays even a bigger role because it can really stimulate the growth. Now, DHT is a product that's produced from testosterone when it's broken down by an enzyme called 5-alpha reductase. So we'll talk a little more about that when we talk about medical treatments. But just understand that it's the DHT that causes some of that problem with the enlargement. Family history can play a factor, just like anything else. You kind of have things that run in the family. We've seen that with patients. They'll say, yeah, my brother had trouble, my father had trouble, my uncle, my grandfather. You just see it running in the family, just like big feet and big nose can run in the family. But there are some lifestyle factors that we do think can contribute also to prostate enlargement, such as lack of exercise and obesity. Now, the symptoms are pretty common. Most patients are going to start experiencing more frequent urination. You're going more often, especially getting up at night, where normally you should be able to sleep through the night. You may notice it's a little hard to get that stream going. It just kind of starts and stops sometimes. The strength of the stream won't be as good as it used to be in the old days. No more writing your name in the snow. So you can get a weak stream. And sometimes you don't feel like you really emptied your bladder. You get up and the next thing you know, you're getting an urge to go again. Sometimes that urge can be so urgent that you have to rush to the bathroom. Another sign that your prostate's maybe the cause. And sometimes you can even have leakage of urine where you actually wet yourself. So these are all symptoms that come with enlarging prostates, all treatable. How do we diagnose BPH? Well, it's pretty simple. Most of the time, symptomatically, you can diagnose it from what a patient comes in complaining of. We even have a little score that we have patients fill out that'll tell us what the risk of their prostate issue is. A plain old digital rectal exam, the kind of finger feel of the prostate, will give an idea of how big it is. Again, we're measuring, though, the outside, not the inside of the prostate. We do always check things like a urine test to make sure there's not an infection. PSA is used to screen to make sure we're not missing a cancer causing increased size of the prostate. There are other tests like uroflow, which measures how fast the urine's coming out. Done in the office, very simple test. You just urinate in this little special machine. And sometimes it can be combined with other tests to kind of measure how hard the bladder has to work to get the urine out. So these things are used. And I did talk in our last episode about prostate biopsy using ultrasound. Well, that ultrasound machine can actually measure the size of a prostate. So if we have an idea of the size of your prostate, that can also give us some factors. But it doesn't really tell you on ultrasound whether it's enlarging inwardly or not. Sometimes you can see things called like a middle lobe that may indicate inward enlargement. Now, I also want to take a moment at the end of this show just to say that our website is probably the best place to go, our UroPatient website. So I'm going to take you on a little tour of the UroPatient.com website. So just go to UroPatient.com like it says there. It'll bring you to this page. Our homepage has the upcoming episode. So there we can see February 24th, 10:30 a.m. Central Time. What is BPH? Also, it's where you can watch the episode live, or you can watch the video on demand for any of our previous episodes right on our homepage. The other place you can go to is our YouTube page. This will take you right to the UroPatient Podcast YouTube page, which gives you access to all the videos, or you can separate them out. So by hitting videos, you can just look at the full-length videos. Or if you like those 1-minute shorts that are meant to be watched on your phone, go ahead and click over to that. Next area I want to show you is our Facebook page. You can go to our Facebook page right from the website. It's our Facebook group, our UroPatient Podcast group, where you can go ahead and join us, and you can comment, and you can also watch the episodes live or on demand from the Facebook page. Another option for you. And finally, I'd like to show you this part of this website called the download section. Anytime I create an episode, I always like to create a download that goes with it, some information sheet. So you can go to these information sheets at any time. You want to find out about prostate biopsies, just click on it. It'll bring that up. And here we go. It's available for you to download free of charge. So I hope you found that helpful. Be sure to check out that website. If you're watching us on YouTube, and YouTube is our main place that we broadcast to, be sure to hit that subscribe and that like button. That'll help us out. And remember, next week, we're going to start talking about more things on how to treat the prostate problem. So if you've got an enlarged prostate, how do you treat it? We'll start off real simple with the medications. Simple because you don't have to have any surgery. But there are a lot of great procedures out there, and we're going to discuss them all. So join us next week for more of UroPatient Podcast.